welcome to our show Expert Speak. Today we have Dr. Manish Dubey, consultant urologist and andrologist. Today he will talk to us about various urological conditions, their diagnosis and treatment. Could you tell us what is urinary leakage? How common is it? And how do you treat such a problem?
Urinary leakage, which is basically scientifically called as incontinence, which means there is a basically inability to control the normal mechanisms of voiding, that is to retain urine when you want to retain it and to void when you are free to void and a place is there to void. So it's a kind of a major problem in the population, but it is very underestimated. If you see a general population which is beyond the age of 50, about 30-40% of all old men and women will be having some kind of incontinence, either small or big. But the time when they approach doctor is pretty pathetic all over the world. Even in developed countries in US, the average time they approach a doctor for their incontinence is almost 1 to 2 years. In India, I'm sure it must be more than that, because culturally for women it is considered as if continence could be a part of their life, and maybe it's a kind of a bane which they have to face because they are women. Secondly, in men, one of the causes that they don't approach doctors is they are afraid of basically they think that leakage of urine may mean an operation or may mean something which is more sinister. And secondly, some of them shy away because they think it's more of a women problem and it's happening to me, so maybe it's something which I should not be telling people around. These are the reasons when patients don't come to doctors and don't tell about their urinary leakages. But once they start approaching doctor and they find out that most of the incontinences, about 75% to 80% of them, can be treated only by visiting doctor for 1 or 2 times itself, and maybe there is no operation required, they feel confident, and most of them are pretty happy after that. In patients who are basically not old, I mean they are young people, I mean children and young boys and girls, there is a very high likely that they approach doctors, one, and secondly their problems have something organic behind it, some disease process which needs to be treated mostly by a surgical means and rarely by a medical means. And these are the ones which basically comprise of the most of incontinence that approach doctor at an early phase, and most of them are pretty well treated. In children, which are basically congenital problems, which means they are born with such issues where the openings of the ureters, which means the pipelines which drain the kidneys, are actually implanted by nature at a wrong place, and that's why they are leaking. One of them, many times these children have something which is more of a spine or brain problem, which ultimately leads to loss of control of urine by the urinary bladder, which is controlled by the brain and the nervous system. So these are the things which basically cause urinary leakages in this age group. These people are treated as and when they come to the doctor, the diagnosis is done. It's a pretty meticulous examination is required to first point out from the whole gamut of problems what exactly we need to focus on for this patient itself, which may mean actually investigations which are as basic as a routine checkup of urine, or it can mean as complicated as something called as urodynamic study, which is done in a very complex way in laboratories, where tubes are inserted into the bladder and the pressures are measured into the bladder, and coordination of the bladder and the outlet voiding is examined on a television or on instruments which can see all these things. So, and in between all these two extremes of investigations, there are things like cystoscopy, where right examination of the urinary tract is done, ultrasound, CT scan, and stuff like that. Once the diagnosis is there in your hand, and when you know that the leakage is because of one X thing, more or less they go into two broad categories. One is basically medical management and another is surgical. The medical management includes some medications which are basically the crux of the whole treatment, but actually speaking, more importantly, there are certain exercises and stuff which are basically for old women, which are to be taught to them, and counseling has to be done about their water intake and stuff like that, so that they can manage their incontinence at home. Many people, especially in the old age, may remain still incontinent, which means they still keep on leaking with all means already given by the doctor, by the urologist. Then in those situations, diapers are the ones which are kind of a little last resort. People who can void out and empty their bladder, diapers are best for them, but very rarely and unfortunately some people will still land up with having tubes into their urinary bladders called catheters, and then they remain lifelong with those things. But these things are pretty rare. Most of them get treated if they approach doctor at the right time.